Hello, everyone, and welcome to the 2023 edition of Infection Control for the Fire Department. Things are going to be a little different with this presentation. A lot of it's going to come down to the result that we received by sending stuff out to the lab. It's not honestly quite as good as I hoped it would be, but we'll kind of cover it when we get to it. But overall, the objectives of today, we're going to recap the infection control program itself. We're going to talk about some emerging items that are coming out this year. We're going to talk about our infection control strategies, and then we'll do the look around our buildings. So, what is infection control? For us, it's outlined in Policy 901, and pretty much it says it's compliance with all relevant laws or regulations related to communicable diseases. So pretty much anything that we can pass to each other or pass to other people throughout the course of our work, it falls on that side of things. It establishes the Department Infection Control Officer, and then also gives us the compliance guidelines with the Association of Occupational Health Professionals and Healthcare Standards. That's the group that really sets everything in motion when it comes to if you have to be removed from work for whatever type of illness or disease, they're the ones that set the standards and the recommendations for it. With that, there's NFPA 1581. It also establishes the Health and Safety Officer, who acts as the point of contact and liaison between the medical staff of the hospital and the affected employee. Also with that, sets forth the requirements to maintain any type of health records. This can be vaccine records, records of past illnesses, test results, anything along those lines, all falls into this subcategory. Here's the big ones to remember. Communicable is any type of disease or disease process that can be passed from one person to another. Direct contact is going to be passed directly from person to person through either droplet or fluid. So someone gets blood on you or spits in your face or coughs in your face, that's going to fall as a direct contact. An indirect contact is going to be something to where you have something on you and you touch the mic in the medic unit and it sits there for a couple days and then the next person grabs it. Now they've had that contact with it. That's going to be an indirect contact. Now, here's one of our struggle points is what is an exposure? An exposure is classified as anytime you come in contact with a bodily fluid through an open wound or mucous membrane. So if your skin is intact or you have a scab covering it and someone bleeds all over it, it's not an exposure. If you're wearing the proper PPE for the patient, it's not an exposure. So if you have our typical COVID patient, you know it's COVID walking into it, you've got on goggles, you've got on safety glasses, you've got on mask, you've got a gown, whatever the appropriate PPE is for that, it is no longer an exposure because you have yourself covered. Now, if you're exposed, and this is talking whether it's going to be blood or a needle stick, the first thing to do is give me a call. Every hospital does things differently when it comes to how they do source testing. If I don't know about the problem, I can't help with it. After that, give me a call. I'll get the ball rolling. Notify Battalion 70 because you're going to be out of service for a while. You're going to notify the charge nurse at the destination hospital of what happened, and be very, very specific with it. That you had a patient spit blood into your face or into your mouth or into your eyes. That way it triggers them and gets the lab up and moving. And then the incident form for our incident reporting, complete that as soon as possible. In some cases, this can require time off work. It can require a litany of medicines that you'll have to be on after the fact. We want to get it documented as soon as possible. So here's the question of the day. What does the patient have to tell you? That really depends on who you ask that question to. The law does state that you're required to report any infectious disease to a healthcare provider, but a lot of people don't. If it is found in a patient's record, or even that after you've left, the infection control officer will be notified. So realistically, people aren't always honest. Yes, the law says that if you walk in and they have some type of infectious disease, they are supposed to tell you. There is no penalty for them if they do not. So, with that being said, you have to kind of play this with a little bit of caution based off of how your patient presents. After we drop off the patient, if a record is found down the road or something comes up in subsequent testing that you may have been exposed to, the lab or the EMS officer at the hospital will contact me and then I will contact you. So if you do source testing, so i.e. you get a patient that spits blood in your face, they will test that patient as a source. They will test you to get a baseline. And then any subsequent testing that comes down the road or results, the only one that's going to be notified will be the employee. The department will not receive any notification of what those test results are, mainly to maintain your privacy. The only thing that we will get in return is that a test has been completed. So that's one thing you will have to make sure you provide them with good contact information, because they will, if you say, hey, just call the department, they're not going to notify you at all. You have to provide your information. So according to the CDC, these are the things that we need to be concerned about this year. Flu, COVID, RSV, measles. I have this on the list. I don't really go into it a whole lot. It was a very big spike in 2022. It really kind of trailed off in 2023. So, but right now, we are still in the midst of flu season. It starts in October and runs into March. So we're in March of 2024. It was a mild season last year. Right now, between 9 million and 11 million cases, depending upon which number you look at. This year, we are up a little bit. We're looking at a 10% increase since December 1st. Right now, the most common one out there is influenza A, which is the H1N1. What you end up getting with that, you get sore throat, you get muscle aches, you get body aches, you get fatigue, and if left untreated, you can get dehydration. So, flu is spread through direct contact. So this comes back to that previous slide of it's got to be somebody coughing in your face, a direct touch, a direct person-to-person contact. It will not survive in that, passive environment. So if you have the flu or you think that you have the flu, testing is available all kinds of places. The biggest thing, if you're sick, stay at home. Don't come to work and then turn around and go home, because a couple reasons. One, it does cause a staffing issue, but two, most importantly, think about your coworkers. If you've been in here, you've been around them, anything you've already passed them at that point in time. So if you wake up and you don't feel well, just stay home. The actual rules behind it do say that you stay at home until symptoms have improved and you're fever-free for 24 hours without the use of any fever-reducing medication. If you notice that, that's very similar to the COVID guidelines. And guess what? COVID. COVID is still here. It resembles the flu in a great deal. You may get loss of taste. You may get loss of smell. This kind of slimmed down version is not quite as strong. So there's not getting as many reports of the serious cases that are out there. You can get testing done at your primary care physician. You can go to Walgreens and get a test. I have over 200 tests sitting in my office that I can give you if you have that concern. Where things have really changed with this is the way that cases are reported now. In the initial inception of COVID, cases were getting reported up to the health department, either from the individual or the primary care doctor, because testing was so restricted. Where now the vast majority of your testing is being done as an in-home setting. Most of those people are not calling in and telling anybody that they have COVID. They're simply seeing the test result and they're staying home for a couple of days. Right now, most of our county surveillance is actually done through sewage testing that comes out of the city of Hamilton. When it comes to isolation guidelines, they haven't changed in a little bit now, which is a good thing. They are not nearly as restrictive of what they used to be, but they do change based off of what the current environment is. If you test positive or you have a severe exposure to COVID, call me. We'll walk through it. We'll see what it is. If you need a test, I'll get you one, and then we can kind of go from there when it comes to work restrictions if need be. RSV is another one. You probably heard a lot of that pop up here recently. It's been under a health alert since October, and the biggest thing, RSV was much more limited to children. The current variant that's out there is affecting pretty much any age that's out there. The biggest difference with RSV is it can be passed through indirect contact. It can live solidly on surfaces for well over 4 hours. Testing is available for it, but it's in a much more limited capacity than what COVID is. So if you have a patient and you have suspicion of RSV, throw a mask on them. Think about it when you're going into the EMS rooms. Don't walk into the EMS rooms with your gloves on. Okay, take them off. Clean your surfaces, because if you have it on your gloves and then you pass it to somebody in there, it's just going to keep passing down the line. When it comes to disinfection, we got a lot of different options. A couple of the medic units do have the UV lights that are built into it. We do have a vital oxide sprayer. It's housed here at fire headquarters, but the battalion can take it out to wherever we need. We do have bleach wipes for certain situations, and we have the cavity wipes. The biggest thing to keep in mind is that all of our disinfectants that the department purchases are all going to be quaternary. We don't really purchase anything that's going to be very limited to one or the other. We want something that will take out a mold, a spore, a virus, and a bacteria all in one swoop. So the cavity wipes are overall one of the best ones we have here. The lemon quat and things like that we have, those are all quaternary. Spray it on, let it sit and dry, then that'll take care of the vast majority of things. So some best practices. Use PPE to your advantage. We have a boatload of different types of PPE available, between masks and gowns and N95s and goggles and safety glasses. Use it. If it's a respiratory call, mask the patient and mask yourself. Okay. Whether it be a simple face mask, or if you feel you want an N95 based off the situation, great. Take the precaution. I'd rather you guys stay healthy than get an exposure by running into somebody's home. Here's the other big one. We send, in some of these respiratory calls, 5 and 6 people on a run. If you don't need them in the room, kick them out. Okay, the minimal providers that are needed on the inside, the better, because that reduces that level of exposure. If there's a splash hazard, you've got, a altered mental status, you've got a severely intoxicated patient, you've got a trauma patient, you're going to be doing an intubation. Put your safety glasses on. Keep that stuff out of your eyes. And finally, no food or drink in the patient compartment of the medic. While I know it's very uncommon to be back there eating and drinking, best practice is not to, because think of the patients that you've hauled in that thing. Think of how long some of this stuff stays around, and do you really want to be passing that, from the bench seat to your Cheeto to your mouth? So here's the part with the station. So things were a little different this time. I'm running out of places that'll do the test for free. They gave me 5 samples that I was allowed to take in. Miami Valley South Hospital up in Centerville performed the test for us. So to make it kind of even, I went ahead and just did the samples all taken from the keyboards that are in the radio room. That way there's, not these strange things of where some people are, some people aren't. We keep everything even. So the results, every station came back with adenovirus, which is, in a sense, it's somewhere in between, in a sense, the flu and the cold. It can live on surfaces for well over a month. Every station did come back with E. coli on their keyboards in their radio rooms. Now, it doesn't really tell me exactly what the levels were, but it was enough for it to test in a non-trace amount. So it means it was a little more. E. coli can live on a hard surface for 28 days if it's not disinfected. Now think back to your EMT school, your medic school, and remember what part of the body E. coli comes from, and then remember that's on your keyboard in your radio room. Here's the big winners of the list. Some of these might not cause an infection, but it's something that you don't want to be around. So Station 71, you did come back with feces on your keyboard in your radio room. Station 72 came back with norovirus. Station 73 had ephectolitis, which is Very similar to an E. coli, just not quite as strong. Station 74, you did have a trace of MRSA. Please keep in mind there are a couple different factors when it comes to MRSA. This may not be the overall, extremely bad type. It just did show up a trace of MRSA. And Station 75, you did have a trace of human blood on your keyboard in your front radio room. So I know this was kind of a quick, this is just kind of a recap of things. We know what's out there. We know the type of environments that we're getting into. The biggest thing we need to do is take the time to clean and disinfect the station equipment. Nobody wants you to get sick, and I don't want you to take anything home to your family. Nobody wants to pick up something from a nursing home run and take it and pass it on to your kids at home. So thank you very much for listening and stay healthy.